Welcome everybody to Lessons from the Field. This is the series of interviews we do with a diverse array of guests, all who have a common thread, and that's a passion for pharmacy and pharmaceutical sciences. And today we're featuring Deanna Horner, who is a graduate of our PGY1 residency in 2008. She's currently Vice President for Specialty Pharmacy at United Healthcare. And as with the other guests, I'll be asking Dr. Horner a series of questions to gain insight for our guests on their career and her experience that may benefit the students and alumni and friends that might be listening. So let's go ahead and get started. Deanna, if you want to just walk us through in a few minutes your career since you, I guess, graduated from pharmacy school.
Sure. So I graduated from pharmacy school from UCSF Medical School of Pharmacy, and went on to complete 2 years of residency. The first year at University of Illinois at Chicago, and then the second year I specialized in critical care and went to University of Kentucky. And then from there, I was really, interested in pursuing a critical care pharmacist position and was able to secure one at UCSF Medical Center, both in the medical surgical ICU as well as the cardiothoracic unit. So at the time we had a team of critical care pharmacists, and we were able to rotate to support the various adult intensive care units there at the hospital. I also at that time was an adjunct faculty, so did present both didactic coursework and then also helped coordinate the critical care rotation for our students there at the pharmacy school. But while I was at UCSF, I had the opportunity to kind of broaden my scope of work to various quality improvement projects that we were doing at the time, both for ischemic stroke management and also for patients coming in with septic shock. To have kind of guideline and protocol-based improvements at the hospital. And in doing some of that work, I ended up just getting more involved more globally and just beyond patient care. And when our clinical pharmacy manager was out on maternity leave, had the opportunity to step in and cover for a 6-month portion for the clinical pharmacy manager at UCSF. During that time, and that was actually when we were going through the EPIC transition, where we were transitioning from more of a paper and electronic medical record-based care to fully based in electronic medical record. And after having that opportunity, was really kind of set then more on the management side and wanted to see what else was out there. It also happened to be around the time that I had my first daughter. And so we were looking at relocating to Illinois. And they did have a clinical pharmacy manager position across the 4 Chicago hospitals within what was then Vanguard Health, that was then acquired by Tenet Healthcare. And so made that transition and was able to work at 4 of the Tenet hospitals as the clinical pharmacy manager. Where I filled more of a consultant role and helped with clinical program design. So we, established the emergency department, clinical pharmacist role at some of the hospitals. We played a role in the antimicrobial stewardship, specifically at one of the hospitals, and even kind of continued to work within critical care, but more on kind of helping support the clinical pharmacists that were working in that, both in the ICUs at those hospitals. And as part of that role, I was also involved in formulary management for the hospital, and then also supporting their transition to electronic medical record and automated dispensing cabinets. And then from there, because I was more in a consultant role, I was interested in pursuing an option where I could have more direct management of pharmacists and pharmacy technicians. And at the time, United Healthcare was offering a role within their Part D STARS program, where we were trying to build a team to help support the improvements in medication adherence for the United Healthcare Medicare Advantage membership. And so that's when I transitioned to managed care. I saw that as an opportunity, and I interviewed and got that position. And so now I've been at United for about 5 years.
Great. Well, thank you for that. Really a lot of experience in a short time. And I forgot to mention that Dr. Horner's from Downers Grove originally, and actually went to Urbana-Champaign for undergraduate and worked on campus here a little bit before that. And it was good to have her back to do her residency here. But Deanna, when many of our students are really interested in kind of more of the details of the job, to get a better idea what it entails kind of in the actual activities, day to day. And so maybe for what you're doing now, which is a big interest to our students, you could just tell us a little bit about what your typical duties are on a daily or weekly basis.
Sure. Yeah, so for specialty pharmacy is kind of a broad term. So for the work that I do and that my team does for United Healthcare, we focus more on the provider administered drugs, so the medical drug benefit. And the reason for that is because United is quite large, and the number of members that we support is also large. So I work on the government programs team supporting Medicare, Medicaid, and our exchange markets. And so the work that I do is really with the focus on trying to simplify our processes for our providers, and then also trying to address how we can identify and access high-value, clinically appropriate drug care for our members. And so the kind of the day-to-day activities that I will focus on is specialty pipeline oversight, so understanding the drug development pipeline, trying to understand the timing and context of what that means for our business and our membership, proactively considering how we'll manage new drugs as they get approved by the FDA. And I think both of that really allows us to be thoughtful about our strategy and making sure that we're also alerting appropriate stakeholders, whether it's our actuarial scientists, healthcare economics, and finance teams when new drugs, are going to be FDA approved. The second kind of bucket of the work that I do is specialty trend oversight. So I'm, monitoring patterns that we'll see both with our pre-service case decisions, so those cases that are going through the prior authorization process, as well as our medical claims patterns. So are we seeing things that are different? Maybe that would trigger us to suspect some inappropriate medication use, or are there just changing prescribing habits that may be kind of more national, or things that may be more nuanced by location. There's also other external influences that I'll be monitoring for, things like seasonality, or, especially with effects of COVID that we've seen for the medical drug benefit. The third kind of weekly task is related to program strategy development. So thinking about, how we can curb inappropriate medication use. Does a drug product or a class of drugs require prior authorization? Do we need to think about a step therapy or preferred product strategy? And then is site of care redirection an appropriate strategy? So would a drug that may be given in a hospital or hospital outpatient facility be more appropriate in an office-based setting or even at home to, not only be affordable, but also from a convenience standpoint for our membership? And then once kind of the strategy is identified, detailing the intervention. So what is it? What are we looking at? Is it supported by the literature? And then how does that impact our provider and member experience? Mm-hmm. And then once, we've identified kind of a strategy, the fourth kind of component of the work that I do on a daily basis is really trying to operationalize the intervention. So in my role, a lot of what I do is a cross-team collaboration with multiple teams outside of pharmacy that would help us and support us in, let's say, implementing one of those strategies like prior authorization. And then once again, simplifying the experience has been a huge focus for me and my team this year, really around automation of the prior authorization process.
Wow, that's a huge scope. It sounds really interesting, though, all the things that you're involved in. I guess the next question I wanted to ask you is about how the residency that you did here helped prepare you for what you're doing now. I know that you had a lot of experiences in between, and all of those are cumulative. And but maybe if you reflect back on your residency here, and was there particular parts of that or things that you learned that have been especially valuable as you've moved through your career?
Sure. Yeah, I would say at the time they said that a year of residency equates to about 3 years of actual work experience. Definitely feel like that was the case for me, if not more, because I tend to learn through doing. And so I felt like the residency experience at UIC was helpful because I was able to get exposure to a wide variety of pharmacy disciplines through, the frequent rotations. We also had a longitudinal clinic experience. So I was in the neurology clinic and I did an infectious disease research project. So I think those 3 pieces plus the on-call program really set me up for success. And it's hard to learn a concept in pharmacy school to really understand how it applies to patient care unless you actually work up a patient and apply those tools. Yeah, so I think that was really helpful. The other thing I would say is the preceptor engagement at UIC was particularly impactful for me, not only on rotation, but also in the on-call experience. We had noon report, and oftentimes we'd have preceptors sit in to discuss cases or give email feedback for the cases that we worked up overnight. And I mean, that's kind of experiences that you can't replicate in actual practice, where you may be the only pharmacist on rotation. You tend not to have that kind of mentorship when you're actually in the workforce. So that was extremely invaluable.
Yeah, I can see that. It must really reinforce what you felt your experience was, and whether, there might have been other things that you could have done or other options, but that's very helpful. Thank you. I guess the kind of related question, but as you've moved through your career and become responsible for more, maybe less on the patient care side, but more population level, more people, more teams that you're working with. What techniques have you found that work to stay relevant, to continue to expand your knowledge base so that you are able to perform your job effectively?
Yeah, that's a great question. So when I was in pharmacy school, I often thought to stay relevant, I was more focused on the science, the pharmacology, right? So if you could stay up to date on the evidence, then you would be in good shape. But what I found is actually you need to stay up to date on the science, but also, at least in my position, on, the business and leadership skills become key. So what I do is I tend to do a lot of reading across, science, business, and, leadership or management type material. I listen to podcasts, I attend webinars, but then also within United Health Group, we tend to have a lot of infrastructure around career development and really promoting reflection inwardly on kind of what we're learning, where we need to improve. We use a tool called the Common Language of Leadership, which is, they have it parsed out if you're an individual contributor or if you're a manager or leadership level, is really trying to understand what are your strengths and what are your weaknesses, and where do you need to grow in the short term and long term based on your goals. And so that's kind of the stuff that I'm, outside of like the workday, working on consistently.
Okay. Yeah, that sounds great. I guess you're involved in a lot of leadership at this point as a student or earlier on in your career. It sounds like maybe your focus was more patient care. But what were there leadership? Do you think there's opportunities, or were there things that you wish you would have learned earlier about leadership or administration that would have been beneficial at this point?
Yeah, I think early on, what I didn't appreciate about being a leader is that you don't necessarily need to have all the answers. I think as a clinician, I understood that because that's, why we have specialists. You don't necessarily need to have everything, know everything off of the top of your head, but you need to at least know how to find the answers and or whom to consult. Leaders are the same, right? So it's really being able to recognize your blind spots, that you have them, that they exist, you kind of know what you don't know, and that you can bring and surround yourself with the right people and build with those relationships to offer those diverse perspectives to ensure that you're thinking about things correctly. And then that's why, we often have a lot of cross-team collaboration, because as pharmacists, even the pharmacists that sit on my team or myself, we may be thinking about a problem in an entirely different way than our finance colleagues or our product colleagues. So that's often why we try to get diverse perspectives on something prior to moving forward with it.
Mm-hmm. Maybe kind of related question, but is there anything so far in your career that's really surprised you or stood out, like that you maybe would do differently or anything like that?
Yeah, I don't know if I would do it differently, but I think the varied aspects of my career is a surprise. Like if you had asked me when I was going through either pharmacy school or as a resident what I'd be doing today, it would probably have been more focused on patient care. And even when I was at UCSF, they offered, a choice of 3 pathways. We could have selected the pharmaceutical care, health services and policy research, or pharmaceutical science. And, I did not hesitate at that point. It was always pharmaceutical care. But interestingly enough, as opportunities presented themselves to me as I was kind of moving through my career, my interests have changed. I was not only just interested in patient care, I was interested in kind of the broader scope of how we can help improve, care and try to even prevent some of the hospital like readmissions and things of that nature. So I think that's probably the biggest surprise, is that it wasn't like a straight line in terms of what I was hoping for. My 5-year goal and 10-year goals were probably very different.
Yeah, that's a good lesson for any student, I think, is just that, your interests can change over time. You don't necessarily have to hurry up and get to where you think you're going to be, because like you can build along the way and you may end up changing directions as well. So that's really good.
Yep.
So just for our students and those out there listening, do you have any tips on success in the workplace and career or life generally?
Yeah, I would say, stay curious and open-minded about new opportunities. I think that's what helped me. I didn't just shut things down. Like if there was an opportunity, I would give it a go. And I found like through that's what has helped me evolve over time. And I would also say, continue to think about like what energizes you about the work that you're doing, or even just, your home life, right? Like, what do you want to find? How do you want to spend your time? And I think that will help kind of frame up kind of the next steps, either for, how you spend your time at home or even career movement.
Yeah, that's good advice. How about for people just starting out? Would it be the same like for folks that are early on in, say, their pharmacy degree program, or even contemplating pharmacy school?
Yeah, I would say definitely like staying curious. I think you have to start somewhere. So if you can think about what motivates you and what you're interested in pharmacy right now, like starting with that, but then also being open-minded that your interests may change or new things may bring new interests. So really just being open-minded and kind of following along as things, sometimes people are in the right place at the right time, where there's maybe an opportunity that wouldn't have otherwise presented itself. It may be available for the taking at that point.
Yeah, we hear that quite often in this program and then other speakers that we have on campus. So, well, thank you so much, Dr. Horner. This was fantastic, really great advice and interesting career. And we're glad to have you back in Illinois. And if you're, if you're interested in visiting the college again or getting involved with our students, we'd love to have you. So, thank you.
Great. Yeah, thank you.